students. Today we'll discuss about rheumatoid arthritis. Rheumatoid arthritis is a autoimmune disease and chronic inflammatory disorder. What do you mean by autoimmune? In case of autoimmune, the loss of normal capacity to differentiate self from the non-self, resulting in immune reaction against our own cells and tissue called autoimmune disease. Now, symptoms of rheumatoid arthritis: peripheral synovial joints, neurologic and vascular abnormalities, low grade fever and pain, swelling, tenderness in the fingers and toe, shoulders, knee and muscle stiffness, particularly in morning, that lasts for at least 1 hour. Now, primary symptoms are pain, swelling, destruction of the bone cartilage, results the disability permanently, destruction of articular cartilage, of small joints like hip, hands and. Now, there is permanent tissue damage. Next is nodules of connective tissue is known as rheumatoid nodules in the forearm and elbow. Now, etiology of rheumatoid arthritis. It occurs mostly in women between the 35 and 55 years after post-menopause. Normally 0.3 to 1% of world population is affected from the rheumatoid arthritis. It is also noticed in the smokers who are positive for rheumatoid factor, that is immunoglobulin M and immunoglobulin A, and permanently leads to disability. Now we come to the pathophysiology. I have told you that it is a autoimmune disorder. Autoimmune disorder, like here we can say, it is patients who are genetically susceptible, they are CD4 helper T cells recognize the antigen, and helper T cells releases the cytokines like TNF alpha, human necrosis factor alpha, interleukin 1 and interferon gamma. This TNF alpha activates the B cells and leads to anti-immunoglobulin G antibody, that is rheumatoid factor, whereas interferon gamma activates the endothelial cells and release of adhesion molecules. Interleukin 1 activates the macrophages and releases the cytokines and proteases. As a result, formation of immune complex along with inflammatory cells and pannus occurs. Pannus is the growth of inflammatory granulation tissue, which consequently results destruction of the cartilage and tissue and inflammation in the synovial joints and small vessels, collagens, and there is joint deformities due to destruction of cartilage, bone, fibrosis and ankylosis. Now, look here. Here, this is the picture of normal joint. Here, synovial membrane is intact and fluid between the joints is synovial fluid, which provides the flexibility for movement. But In case of rheumatoid arthritis, here is bone erosion and swelling, inflamed synovial membrane. This is the pathology. Now, bone erosions. Bone erosions means bone is damaged. Layer of bone is damaged, and there is hyperplasia of synovial membrane, infiltration of inflammatory cells, and new vascularization, which results into bone erosion caused by osteoclast and cartilage dissolution by proteolytic enzymes. Thank you.